Bribery, lying, deceit, doing whatever it takes to make a quick buck, even if it harms those who depend on you. For over 20 years, this approach has worked wonders in healthcare, built empires, padded pockets, and made intermediaries rich while the people delivering care got squeezed. But it's time to fight back. Year after year, CMS, that's the Centers for Medicare and Medicaid, have cut the physician fee schedule. They reduce resources for those who are on the front line of medicine. This year, just like nearly every year for 2 decades, CMS has slashed the physician fee schedule again, this time by nearly 3%. And who's getting more? Shocker! The health systems are the big players who've never seen a single patient but have a stranglehold on the system. They are getting a 3% raise. Today, we're going to investigate what this decision means. If you think it doesn't affect you, think again. When our healthcare system rewards bureaucracy and cuts support for the people delivering care, you're all going to pay the price. When you undermine physicians, you undermine healthcare. When you undermine nurses, you undermine healthcare. You're not just squeezing the people on the front lines, you're affecting everyone who walks into a clinic, relies on a diagnosis, and trusts their physician to be there when they need help. So let's get into it. Why does the government system keep rewarding the bureaucrats and intermediaries while pushing the people who do the work to the very edge? Here's the thing about Medicare. It's not a financial lifeline for physicians. It's anything but. Today, more and more physicians are opting out of Medicare, choosing instead to work with commercial insurance, personal injury cases, workers' compensation, and all other forms of reimbursement that allow them to cover their expenses. Why? Because Medicare reimbursement is horrendous. Yet despite these cuts and abysmal reimbursement rates, tens of thousands, maybe hundreds of thousands of physicians continue to contract with Medicare. They don't do it for the money. They do it because they're committed to serving, helping, and upholding their duty to patients who rely on Medicare. Every year, CMS makes that commitment significantly harder to keep. A 3% cut sounds like a minor adjustment on paper, but to the independent physician, it's another burden added to an already overwhelming load. They're forced to make tough choices: fewer staff, outdated equipment, and less time with each patient. Every cut drives another nail into the coffin of private practice and independent medicine. These aren't faceless entities either. These are real people, professionals who went into medicine not for wealth, but to help, heal, and serve. And what are they getting in return? A bureaucratic system that continues to value them less and less. Now let's flip the coin. While physicians are told to tighten the belts, health systems, right, the big players in GovCon, are getting a raise. Yes, those are the primary healthcare corporations that dominate the market. There's one in your area. Those, ironically, don't see any patients. They're getting a 3% increase to account for inflation and rising expenses, while the very people providing the care are told to make do with less. Why is CMS so concerned about covering inflation for massive, big health systems, but not for physicians? Why does the government protect the revenue streams of the bureaucratic entities while undermining those who actually have to go face-to-face with patients? This isn't a one-off. Time and time again, we see the system bend over backwards to support the big players, whether it's health systems, insurers, or device manufacturers, while leaving independent physicians who deliver care out in the cold. It's a backward incentive structure, one that prioritizes bureaucracy over care. There's an uncomfortable truth, and we don't talk about it nearly enough. The incentive in healthcare is upside down. For CMS and other decision makers, the easiest path is to reward the partners who keep the administrative wheels turning, not the actual physicians who handle the real work of caring for patients. In other words, the current healthcare playbook doesn't prioritize quality, humanity, or basic care. It's built to maintain the status quo, to protect the layers of bureaucracy that insulate the top from the harsh realities faced by those in scrubs. Remember, bribery works, deception works, dishonesty works, and the truth is more difficult. It's the path less taken, but it's the one that actual physicians and those of us who support them are willing to fight for. You might think this is a problem for physicians, or why should I care? Or why should I give up? Here's why. When we cut funding to physicians, we're not just hurting them. We're compromising the entire of the healthcare system. Every cut makes it more difficult for physicians to keep their doors open, to spend quality time with patients, and to invest in technology that could enhance care. And here's the part that stings the most. These cuts, done on purpose, lead to consolidation. Independent practices are bought out by large health systems. More and more physicians are forced to give up their autonomy because they can't survive on the razor-thin margins. And when do these options disappear? Then patients suffer. Cost goes up, quality goes down, and that relationship between you and your physician, the one you were promised, becomes yet another transaction in a GovCon chain. The personalized care we all value has become a relic of the past, replaced by a machine that sees patients as numbers and encounters as billable units. So what can you do? For starters, we can push for legislative change. Physicians, patients, and advocates need to come together and demand that Congress prioritize inflationary adjustments for physicians. If CMS won't protect the people on the front lines, then lawmakers need to step up. And for this entire audience, I want you to know that your voice matters. If enough of us speak up, we can create change. It's very simple. We can demand a healthcare system that values integrity, puts patient care above bureaucracy, and prioritizes value over empty dollars. My message to CMS, of everyone making these poor decisions, if you want, and you don't, a healthcare system that's truly sustainable and patient-centered, start supporting the people who make it work. That's physicians. Increasing health system budgets doesn't mean better patient care. Shifting tax dollars to the largest corporations doesn't bring us any closer to being a healthier nation. And to all of you listening, if you're tired of seeing your tax dollars funneled into the most prominent corporations instead of those going into taking care of patients, demand change. Physicians are ready to lead the way in building a healthcare system that serves people, not just the bureaucracies. Reach out to info@phycap.com. That's info@phycap.com if this message resonates with you. Let's keep the conversation going and fight for a healthcare system that puts the right people in the driver's seat. Thank you, as always, for joining me. Rojas out.